Another question we've been frequently asked, which is the best method of hair restoration? Currently on the market exists a lot of devices and a lot of general methods of hair restoration. Generally speaking, there are two main methods of hair restoration. One is strip method, which existed since 90s. Another one is a follicular unit extraction. Strip method being widely used since last century and creates a linear scar on the back of the head. Don't get me wrong, there are certain patients which the strip method would be the best method of treatment. Just like having multiple drugs available to treat hypertension, we should address same way patients based on what they actually need. For example, people with very curly hair, such as African Americans, strip could be the best way to transplant the hair. Although we've been having some success with African Americans using robotic or motorized methods of FUE, such as neograft. The FUE method or follicular unit extraction method is a little different. So instead of creating a big scar, removing the tissue in the back of the head, we take follicular units separately one by one. We specialized in robotic hair restoration, and we do a lot of procedures using the IX robot. We did acquire an IX restoration robotic system back in December of 2018 and performed close to 100 procedures with the new robot. Prior to that, we used a 9X robotic equipment for the same purpose. We do use neograft as well for smaller cases. One of the main differences between robotic versus motorized FUE is that there is no surgeon fatigue. The robot is able to harvest follicular units one by one with the same efficacy during the first seconds of the procedure and after 3 or 4 hours if necessary. Typically, the procedure lasts around 1.5 to 2 hours for the robotic harvesting. I do perform neograft procedures as well, and I do use a manual motorized punch to achieve the same efficacy. Obviously, for the smaller procedures such as 1,000 grafts, 1,200 grafts, that could be a good option as well.